Hello everyone, welcome back. I'm Rikta. In our last class, we discussed abortions and its different types in detail. Today's session is going to be a little different. I will be asking you some important questions based on what we already learned, and you can pause the video, think of your answer, and then check it with the explanations I'll give. And this way, you will be able to revise the topic and test your own understanding and identify the areas where you need more clarity. So keep a notebook with you, be honest with yourselves, and let's begin this today's questions answer sessions on abortions. So with what we have learned here, like last class, that the definitions of abortions, what we learned, if the termination of pregnancy occur 20 weeks before, then we will call it as abortion. Okay, if termination of pregnancy occur more than 20 weeks, then we won't say it abortions, rather we will say it as preterm pregnancy. So if it is less than 20 weeks, it will be abortion. If it is more than 20 weeks, it will be preterm delivery. Then we classified this abortion majorly into two parts, that is spontaneous, which occurs naturally, and another one is induced, that is by giving drugs or by doing surgical evacuation, intentionally doing this terminations of pregnancy. Then again, spontaneous abortions are majorly classified into 5 parts. One is your threatened abortion, missed abortion, inevitable, incomplete, and complete. And we have discussed in detail about their unique feature. How will you identify those different types of abortions, and what will be the management? Now in today's sessions, we will be discussing some questions answer, and then we will rectify or step by step how will you answer if questions come in your exam paper. Now let's begin this today's sessions with these questions. Okay, in which type of abortion does the pregnancy have the potential to continue? Okay, so what we have learned in last class, that spontaneous abortions which occurs naturally, that's why the another name of this spontaneous abortion was miscarriage. Okay, and that is majorly classified into 5 parts. What we have learned, that those are the threatened abortion, missed abortion, inevitable abortion, incomplete abortion, and complete abortions. Okay, now I told you, if you remember, that this threatened abortion is the only abortions where fetus is alive. Okay, as fetus is alive, that's why pregnancy आगे चल सकती है, pregnancy can continue, and this is the unique feature of threatened abortions. Remaining all abortions, missed, inevitable, incomplete, and complete, in all cases fetus died. As fetus died, that's why pregnancy can't continue further. Okay, so that's why can't continue, and that's why this question's answer will be here. They said about which type of abortion pregnancy have the potential to continue. That's why what will be your answer? Your answer will be your threatened abortion. That will be your answer. Okay, I hope it's clear to you. Now coming to this next questions. What is your next question? Okay, a woman presents with vaginal bleeding, closed cervix, and a live fetus on ultrasound, the most likely diagnosis. Again, this same questions. Okay, so last class we have discussed about various abortions, and you know abortion means 20 weeks before mother will be complaining that bleeding is there. That bleeding can be more or less, can be heavy bleeding, can be scanty amount of bleeding. So this vaginal bleeding is not a unique feature in case of different kind of abortions, means bleeding will be present more or less in all abortions. Now how will you identify which kind of abortion is this? See here, live fetus. When they will say live fetus, you will blindly answer it as threatened abortions, because we learned in last class that only threatened abortion is the kind of abortions where fetus will be alive. Remaining all abortion, fetus will die, and that's why in those cases we can't continue this pregnancy. But as fetus is alive in threatened abortion, pregnancy can continue. Okay, so that's why your answer of these questions will be threatened abortions. Okay, threatened abortion. Now, the next question is that retained product of conceptions after partial expulsion is seen in. Now, product of conceptions, I have discussed this spontaneous abortion is divided into 5 types. Okay, threatened, missed, inevitable, incomplete, and complete. Whenever abortion questions will come, these 5 types of abortions you have to keep in your mind, and the unique feature of them, cervix will be closed here also it will be closed, here it will gets open, here it will gets open again, as all product of conception came out or expelled out, that's why it will get closed again. So this is the only abortions where fetus alive, remaining all abortions fetus died. Okay, this incomplete abortion and complete abortion, in both cases product of conception come out, but the thing is, in case of incomplete abortion, product of conception will come out incompletely. Okay, incompletely. But in case of complete abortion, product of conception come out completely. So here they are asking about partial expulsion. That means some amount of product of conception come out or expelled, remaining all inside the uterus. That's why your answer of these questions will be incomplete abortions. Okay, in case of complete abortions, they will ask you about all product of conception expelled out in which kind of abortion, then you have to answer complete abortion. As they mention that partial expulsion, so your answer will be incomplete abortions. I hope it's clear. Now coming to the next questions. Okay, absence of fetal heart activity. Whenever they will ask you absence of fetal heart activity, that means they are telling about that fetus died. Absence of fetus heart activity, that means heartbeat absence. Okay, heartbeat absent, fetus died. As simple as that. Now, uterus is smaller than gestation. Obviously, fetus died means now uterus won't be equal to period of gestation, and they also mention that cervix closed. So again we will enlisted all types of abortion here. One is threatened, one is missed, another one is inevitable, incomplete, and your complete abortion. So here in case of complete abortion, cervix will be closed. Why? Because all product of conception came out. In case of incomplete abortion, cervix will remain open. Why? Because some amount of product of conception expelled out and some amount of product of conception still remain inside the uterus, and your uterus is trying to expel the remaining one. That's why cervix is still open and waiting for remaining product will come out. In case of inevitable abortion, cervix will be open but product of conception will be inside the uterus. Here also in these two cases, cervix will be closed. So now your question they are mentioning about closed cervix. So you have to think about closed cervix means this can be the answer, this can be the answer, or else this can be the answer. Now they said absence of fetal activity, but in case of threatened abortion, fetal activity will be present. Fetal activity will be present. So you shouldn't think about this threatened abortions. You will eliminate this answer. Now missed abortion can be the answer. Complete abortion can be the answer. Again, uterus is smaller than gestation. Okay. So how will you rectify whether it is a missed abortion, whether it is a complete abortion? In both cases, fetal activity absent. In both cases, closed cervix. In both cases, this uterus will be smaller than gestation. Still, I will answer here that this answer going to be missed abortions. Why? Because here uterus, fetus died and your uterus is now stopped growing, and that's why uterus is usually smaller than the gestation. But in case of complete abortions, your whole product of conception came out, expelled out, and your uterus characteristics will be small, well contracted and emptied. Okay, and emptied. So here they didn't mention about this product of conception and all, so you should not think about this complete abortions. Here also it is smaller than gestation, but if you doing comparison between missed and complete abortions, then obviously this answer going to be missed abortions. It is smaller than the gestation but not well contracted, as because product of conception is still remain inside the uterus, and they didn't mention in question like product of conception came out or not. Okay, came out or not. That's why you should not think about this missed abortion and complete abortion, and that's why your missed abortion is going to be the answer in these questions. Okay, now the next question is cervical os open, bleeding heavy, but all product of conceptions have been expelled. Okay, so all product of conception have been expelled. When they will mention, then you will think about they are describing that complete abortions where all product of conception expelled, uterus becomes emptied. Okay, in case of incomplete abortion, some product of conception expelled, some remain inside the uterus, but in questions they are mentioning that all product of conception have been expelled. So what is going to be your answer? Complete abortions is going to be your answer. In case of incomplete abortion, some amount expelled, some amount remain inside the uterus. So according to the questions language, you have to rectify the answer. So here the answer will be complete abortion. Now the next questions. This is a scenario based questions, and that is important for your Norcet exam. Now a 10 weeks pregnant woman, okay, comes with you with slight vaginal bleeding. This is typing mistake. Okay, slight vaginal bleeding, mild abdominal pain. Check these key features, in which case I have told about those kind of key features. Okay, cervix closed, uterus corresponds to gestational age. That means uterus size equal to period of gestations. Okay, USG shows fetal cardiac activity, means fetus cardiac activity present. See, the same clinical key features I have explained in yesterday's class, where in case of threatened abortion, bleeding is mild, pain is absent. Here also in these questions they mention the same thing. Bleed where? Here. Slight vaginal bleeding, mild pain. Okay, and cervix is closed. Here also we will check. See, cervix is closed. Okay, uterus size is equal to period of gestation. Why? Because here this fetal activity is present. Okay, fetus is still alive. As fetus is still alive, that means baby is growing normally. As baby is growing normally, so your uterus also growing normally, and that's why uterus is corresponds to gestational age, and fetal activity present only in case of threatened abortions. Remaining all abortions, fetus died. Okay, in all cases fetus died. So what is going to be your answer here? It is threatened abortion. Threatened abortions will be your answer. Now coming to the next questions, and the last questions of our today's session is that a woman reports absence of fetal movement. Absence of fetal movement means this option you can eliminate. You can eliminate from here, this threatened abortion. Why? Because only in this threatened abortion fetus is alive, but here they already mentions absence fetal movement. That means baby died. Now again, on examinations, uterus size is smaller than expected. Okay, but in case of threatened abortions, what you have studied, that uterus size is equal to period of gestation. Okay. Now the third, cervix is closed. In case of incomplete abortion, cervix remain open. Why? Because your uterus is still trying to expel the remaining product of conception what is inside the uterus. That's why in this case some amount of product of conception is still remain inside the uterus, and your uterus and cervix is trying to expel the remaining product. That's why it will still remain open. In case of missed inevitable abortion, cervix is open but product of conception inside the uterus. In case of missed abortion, fetal activity absent. Why? Because fetus died. Absent. Okay. Then uterus size smaller than gestational age. Smaller than gestational age. Why? Because fetus is already died and there is no scope to further grow of this uterus. Cervix closed in this case, and USG shows no fetal activity that I have mentioned here. So again we will cross check. So in case of missed abortion, you see fetus dies, you see cervix closed, you see uterus size is smaller than gestation. Okay, so all are the feature of your missed abortion. That's why in this case what is going to be your answer? Your answer will be missed abortions. Okay, so what you learned from these today's sessions, that if any questions come from this abortion, you have to think about this all type of abortions once in your mind. So again we will mention here, that is threatened abortion, missed abortions. I will mention all the key feature: inevitable abortion, incomplete abortion, and your complete abortions. What we have studied in case of threatened abortion, that here fetus alive. Okay, as fetus alive, uterus size will grow normally and that will be equal to period of gestations. Remember, and here cervix will be closed, and here pregnancy can continue. Okay, remaining all cases fetus died, so pregnancy can be continued, and the management is dilation, curettage, misoprostol, mifepristone, etc. Now in this missed abortion, that is having much more similarities with threatened abortion. Only difference is fetus died, here it will be alive, here it will be died. As it is died, so uterus size will be smaller than gestation. Okay, smaller than gestation, and cervix will remain closed. That's why product of conceptions will be inside. In case of inevitable abortion, here also fetus died and this cervix will open. It will be open but product of conceptions won't come out. In case of incomplete abortion, product of conception come out incompletely. Okay, and here in complete abortion, product of conceptions come out completely. Okay, completely. So all these features you have to remember, then only you can answer. Yes, in case of complete abortions, as all product of conception expelled out, that's why your cervix will get closed. No need to open. If you do USG, uterus will be emptied. पूरा खाली हो जाता है. In case of incomplete abortion, some amount of product of conception expelled out and some amount of product of conception inside the uterus. That is why your uterus and cervix will be remain open, so that remaining product will come out. Okay, and in case of threatened abortions it will be closed. In case of missed abortions it will be closed. In case of inevitable abortions it will be open. Although it will be open, but product of conceptions will be inside the uterus. So that's all about this today's sessions. Okay, in this way you have to identify the answer. So today we revised the different types of abortions through important questions and answer. I hope the sessions help you check your understanding and also cleared any confusions. And remember, revision is the key. So try to recall these questions again later without looking at the answer, and that's how you will strengthen your memory. So thank you, dear students.